I had no symptoms, and the scan showed I had a blockage.
Mr. Schmidt's case was very interesting because here is a patient that was referred over for a CT heart scan who was actually asymptomatic. What this case shows us is what we've been seeing in research, that 50% of patients who have a heart attack have no symptoms prior to their heart attack.
My name is Alan Schmidt. I'm 72 years old. I walk at least a mile every morning with the dogs. We square dance a couple times a week, and we also restore early automobiles. My wonderful Dr. Farnese, with my family history, suggested I have a scan at image 1. I didn't expect any problems at all. Hesitated on it. It was a little expensive. I put it off for a while, and he pushed me to do it, and thankfully he did, because they found a major blockage.
I kind of expected with Alan to find some plaque that we needed to work on. What I didn't expect is for him to have a 90% blockage and not be symptomatic, and he wasn't symptomatic.
We brought him over and he got a CT scan with an AI analysis and a flow study, and the result was mind-boggling. As soon as I pulled the scan up, I looked at the images and saw a severe blockage in the proximal LAD artery, which is one of the main arteries in the heart. He had a severe blockage in the widowmaker. At this point, I recommended that he see one of our interventional cardiologists and gave him the option for getting a stent done, which of course he had done, and he had a wonderful result, opened up that artery and had excellent blood flow through there.
I went into it thinking I had no problem. I was shocked. I guess the most important thing about maintaining the cars is making sure all the systems work. I feel badly. I don't understand my body as much as I do an antique car. But fortunately, the CT scan showed the issue and was able to solve that problem before I had a major issue. I'm very happy that I had the test, and I'm able to be here and do this and maybe help somebody else do the test and save them from having a problem.
In Alan's case, my hope is that we spared him from having heart failure or a weak heart or a partially damaged heart muscle for the rest of his life. And he's 72 now. He's got hopefully 20 or 30 more years of activity to keep driving old cars and keep growing avocados, and that just makes my day.
You know, we're very lucky at this point to have the technology to detect heart disease and plaque buildup early. And in a case like this, we're actually able to save someone from having a heart attack in the future.